right, welcome in. Yeah, how are you? I'm doing good. Yeah, it's been a busy day, but it's what I'm here for. What brings you in today? Okay, sure. And did you already get checked in at the front desk? Okay, great. Well, my name is Dr. Matty. Good to meet you. You're new here, right? Okay, nice. Yeah, I mean, I have a lot of patients, but I'm really good with faces, so. Yeah, I know I should be should be a plastic surgeon. Good with faces. These are the kind of terrible jokes that you can expect here at this clinic. So, anyway, so what are we? You're here for just kind of an annual checkup kind of thing. Okay, great. Okay, so did the nurse take care of anything? Nice. Okay. I think I can take care of the rest here. Let me grab this here and let's go over some quick questions. If that's okay. Okay, great. Okay, so this is your chart. Just kind of gonna go through this checklist here. Do you have any underlying illnesses or anything going on right now, or are you just here for just kind of an annual? Okay, annual, nice. When was your last one? I don't have anything on here. A couple years, okay. And then if you decide to come back to this clinic consistently, you'll want to have your records transferred. So make sure to bring that up with the front desk. Okay. Okay. Great. All right. Any trouble sleeping right now? Okay. Do you drink? Occasionally. About how many times a week? Okay, great. Do you smoke? Okay. Any kind of recreational drugs or anything like that? Okay. All right, that's looking good. Are you on any kind of medication? Okay, and when did you start that? Okay, nice. Is that helping? Wonderful. Okay, great. Okay. Love it. Well, if it's okay with you, we can get started here. I'm just gonna do, kind of the normal checkup things. Nothing to be concerned about, I would say. Yeah. Do you have any questions for me before we get started? Okay. Yep. Okay. Yep, I can do that. I can absolutely do that. Yeah, I'm funny enough, I'm actually the same. I can't do the stick on the tongue thing either. That's so funny. Anything else? Any other restrictions or things you're concerned about? Yeah. Okay. Okay. Yeah. Sure. Yeah, that's been it's been kind of a growing concern for people in the last few years, with what's happened in the last couple of years. That's fair. I can actually, yeah, I have a little it's not a machine, but I have a little tool, a medical tool that will test that. So, okay, great. Well, let's get started. Let me put on some gloves here real quick. And yeah, you can just sit and relax for a minute, and I'll get everything going here. Okay. Okay. Let's see. When do I want to start? Let's start with let's start with this. Let's start with the easy stuff. Okay. So we're just gonna do a blood pressure thing here. Okay. So you know how this works, I'm sure. Okay. So this is gonna go. We're gonna go around the upper arm, around the bicep. Okay. And then we'll see where it goes. Okay. All right. Great. So yeah, just come here real quick. Perfect. And then we will, just like that. All right. Are you ready? And just breathe normally. Not a big deal. Okay, ready? Here we go. And gonna keep going here. You're gonna feel it tighten up. All right. How's that feeling? Yeah, it should be getting there. Okay. Okay. Perfect. Perfect. All right. That looks good. Here, I'll take that from me here. Okay. Perfect. Okay. I think what we'll do next is I'll just listen to the heartbeat real quick. Is that okay? Okay. So for this one, I'm gonna get a little bit closer. Is that okay with you? Okay. Great. So, I'm just gonna go kind of the upper chest right here. Is that okay? It's not cold. Okay, here we go. Sounds good. Take a like 3 deep breaths. Nice. Okay, great. Actually, before I put these away, let's have you turn around. I'm just gonna listen to everything from your upper back. Just want to make sure everything's sounding good. Yeah, just turn around. Perfect. Okay, here we go. And deep breath. Perfect. Okay, and let's do one more deep breath. Wonderful. Okay. Great. Good job. Everything seems normal there. Yeah. Yeah. Okay. All right. So everything is sounding good there. Do you have any issues with Oh, okay, you already went over that with okay. Perfect. That's absolutely perfect. Okay, so we're gonna do we'll do a vision test here in a second, just with the little light. What do we want to do next? Let me grab my little tool here. Let's look at your ears. So I have this little tool here, and this is gonna allow me to look in your ear, okay, and just kind of make sure there's no blockage or anything. So is that okay? Okay, great. So I'm gonna go over here. All right, and we're gonna look on your left ear. Ready? Okay. Okay. Looks great. And then same thing over here. Okay. Everything looks great, I think. Are you having any hearing issues at all? Okay. Oh, that's good. Yeah, no, that's great. Okay. One of the other things I want to do is just kind of feel around, if that's okay. Just kind of feel around your face and neck. Is that okay? Okay, so I'm going to get up a little bit closer here. Is that okay? Okay, so I'm just going to kind of feel the bone structure here and around the neck. Okay? Okay, here we go. And just relax. Nice. Nice. Chin up a little bit. There we go. Good job. Nice. Okay. Wonderful. Okay. Everything feels great there. All right. So everything looks good. I think the next thing I want to do is your vision. So I'm going to do a couple of things here. Okay. We'll do kind of a follow the light kind of thing in here in a second, just to check the pupil. But what I want to do here is I'm just going to cover one of your eyes and kind of go back and forth, and all you need to do is tell me what number I'm holding up. Okay, ready? So I'm going to cover your right eye here. Okay, and just tell me how many fingers I'm holding up. Okay. Good. Good. Okay. Good. Good. Okay, that's 100%. And same thing over here. Ready? Here we go. Good. 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 And great. Okay. Wonderful job. So it seems to be okay. So now what I'm going to do is I have this little pen, okay? It has a light on it, okay? And all we're going to do with this is you're just going to follow the light, okay? So try to keep your head completely still, and this is just moving your eyes up and down, okay? Yep, to your best ability, okay? All right, here we go. So I'm going to go like this. So just follow the light. Okay. Okay. Doing good. Just follow the light. Follow the light. Okay, you're doing great. Okay. Great. Okay. Eyes look perfectly fine. let's see. I got a couple more things I want to do. The handy dandy reflex thing. So I'm just gonna sit up on the table there. Perfect. And I'm just gonna tap right below your knee, and just make sure your reflexes are good. Okay, ready? Here we go. Good. Okay, one more time. Okay, and your left. Wonderful. All right, let me, if I can find my pen here, let me make a few notes. And I know when a doctor says, let me make some notes, I know that can be scary, but I promise these are just normal notes. That is not my pen. That's really not my pen. I think it's in here. There we are. I promise these are just notes for next time. There's nothing wrong with you. These are just notes for the nurse. Let's do this. Okay. And do you plan on staying on the medication? Okay, great. I mean, as long as it's working. Yeah. Okay. Wonderful, wonderful, wonderful. Okay. So, lastly, you brought up your respiratory. So I do have a little tool here, if that interests you. That's gonna test that. It's called a spirometer. Have you ever done a spirometer before? Okay. So this is very simple. And how old did you say you were? Okay, perfect. So I will set this a little higher then. Let's go maybe here. Okay. So what this is let me take the tube off for a second. So basically what this is going to do, okay, is you're going to blow, I will put this back on in a second, but you're going to blow into this mouthpiece, and it's going to raise this, and the goal is to get to here. Okay, right there. So when you raise it there, and then you want to be able to hold, this thing's going to also go up, and you want to hold that between those two arrows. Does that make sense? Okay, great. So let's have you just reset this, boom. Okay, so I'm going to have you just blow air into that and see if you can get it to... Perfect. Okay, and then just keep that. Okay. So, yeah, we want to hold it in between those two arrows. So it's kind of a lung capacity thing. So you're blowing air in, but you're also blowing it steady. Okay, here we go. And go. Perfect. I mean, I don't see anything wrong. I know a lot of people have asked that, but I don't see anything wrong. Yeah. Okay, so take these off here. All right. I think you look great. Everything is working. Everything is functioning. Eyes, ears, reflexes, everything. Heart sounds great. So this is I guess doctors don't really give you a passing grade, but this is a passing grade. Everything looks fine. Yeah, of course, of course. Yeah, so I'm here if you need anything. On your way out, make sure to stop at the front desk and have them transfer your records over, so we can get that all archived for you, and you should be good. Of course, and I'm here anytime that you need. Yeah, on the app, you can just choose me. Again, I'm Matty, Dr. Matty, and just choose me, and you can do in person, you could do video chat, text chat. We're here anytime. All right, thank you for coming in, and have a wonderful, wonderful day. All right, we'll see you later.